The question is, okay, if oral sex comes before vaginal sex, does it increase or decrease the likelihood that an adolescent will engage in vaginal intercourse? And what we found is that it depends. It's the academics, perfect phrase, right? Well, it depends, and it does. Initiation into oral sex at the beginning of 9th grade does not increase or decrease the likelihood that they will engage in vaginal sex during the assessment period or at the end of 11th grade. But there's a critical window in which an adolescent may engage in oral sex between the end of 9th grade and the end of 10th grade. And if they engage in oral sex in that window of time, they're at heightened risk to initiate in vaginal sex. This is the first study to follow a group of adolescents from the start of 9th grade all the way to the end of 11th grade. And our aim was basically to document and assess the trajectory of sexual behaviors in this age group. There's very little work being done in terms of recognizing that sexual behavior occurs in different forms. So it's not necessarily just vaginal intercourse, but there are a host of other behaviors like oral sex, primarily oral sex, because it is the one behavior that is most prevalent in this age group. And so there's very little recognition in the literature that these behaviors are related. And if we focus just on vaginal sex, we're missing the relationship between these behaviors and how these behaviors may increase or decrease the risk of engaging in vaginal intercourse, which then increases the risk for pregnancy, sexually transmitted diseases, HIV infection, and emotional and social consequences as well. The message is really think about what the consequences are. That oral sex isn't just oral sex. What could possibly happen if you engage in this type of in oral sex behaviors? For healthcare professionals, it's not necessarily the most comfortable topic to talk about. You see the discomfort not just in the medical community and health educators, but with parents as well. And so the message to them is, at some point, we hope that adolescents grow up and engage in a healthy sexual relationship. And a good step in getting them pointed towards the direction of having a healthy sexual relationship is to talk about it, and that they are fully aware and exposed to the information that they need to make those decisions.